In vitro fertilization, or IVF, serves as an advanced medical technique that helps couples to conceive. Patients will first undergo routine parameter checks prior to their consultation with our specialists. During the consultation, our specialist will perform a transvaginal scan to check for any presence of ovarian cyst and fibroid and give an estimate of how many eggs they are able to retrieve. Assessing of menstrual cycle and running of blood tests is an important step to assess hormonal levels in patient's body. Additionally, performing a semen analysis is essential to ensure the vitality of the husband's sperm. In the next visit, our specialist will review the couple's previous blood tests and semen analysis reports. After evaluating the test results, the specialist will guide patient through signing of consent form. The couple will undergo a consultation with our trained IVF counselor and a session with an embryologist to ensure they are fully prepared for the procedure. To increase the chances of a successful pregnancy, ovarian stimulation is required, usually through self-administered hormonal injections. Patients should inform the clinic on the first day of their period and visit the center on days 2 or 3 to begin stimulation. For 10 to 12 days, follicular growth is monitored with scans. Once the optimal size and number of follicles are achieved, a final trigger shot is given 36 hours before egg retrieval to finalize maturation. On the day of the egg retrieval procedure, patients should register 2 hours in advance. Fresh semen specimens are also collected on the same day. This procedure is typically performed under sedation to ensure comfort. A transvaginal ultrasound is used to visualize the ovaries, while our specialist inserts a thin needle and guides it through the vaginal wall to access the follicles and collect the eggs. The retrieved eggs will then be passed on to our embryologist. After retrieval, patients will need to undergo a post-procedure discharge evaluation by our specialist before leaving the hospital. After eggs are retrieved and processed, fresh semen collected from your husband will be processed to determine parameters such as sperm count and motility. The embryologist will then introduce a single sperm into each mature egg. Fertilized eggs are monitored and left to develop in incubator over the next 5 to 6 days. Embryos that are usable are selected for transfer, and excess embryos are frozen for future transfer. During embryo transfer, the selected embryos are transferred through the catheter into the uterus. Within 2 weeks after embryo transfer, a blood test will be done to check for pregnancy. If the test is positive, patient will begin their journey of prenatal care.